Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Thyroid disease should not be a battlefield, but for millions of people, that is exactly what it has become. Patients are exhausted, discouraged, and searching for answers in places they never imagined. And somewhere along the way, endocrinology lost their trust. I'm Dr. Arti Thangudu, and today I'm joined by two extraordinary colleagues, Dr. Vidhya Illuri and Dr. Munira Mehta. All of us are board-certified endocrinologists, to talk openly and honestly about why patients with thyroid symptoms are walking away from mainstream medicine and what it will take to earn their trust. We're diving into the emotional side of thyroid care, the moments when patients feel dismissed, the frustration of a system that rushes them in and out, and the rising appeal of alternative and functional medicine. We're also talking about the realities we see as endocrinologists, the dangerous complications, the bias on both sides, and the growing divide that's leaving patients caught in the middle. This is not a conversation about who's right. It's a conversation about what patients deserve. So let's take a hard look at the system, challenge the narratives that divide us, and begin rebuilding a model of thyroid care rooted in trust, compassion, and meaningful solutions that serve our patients. Welcome, Dr. Illuri and Dr. Mehta. I'm so excited to have you guys here today with me to talk about this really, really important topic. And I'm most excited to not really breathe information down patients' necks, but more to look at the big picture of a system that clearly is failing thyroid patients in the endocrinology office. Whether or not they're getting the right treatments or not, that's really not the point anymore. It's really how do we build trust in patients so that they do choose safe solutions for their care while also getting to the goals that they want and feeling better. So I wanted to open with, just the fact that many thyroid patients are feeling dismissed and they're feeling like their symptoms aren't being listened to or solved. What are you guys seeing in your clinics that really speaks to this? What experiences have you had?
I can start with sharing some of my experiences. And what I've noticed is, oftentimes my patients have seen other doctors, maybe primary care doctors or even other endocrinologists, and then they come to me. And at the start of the visit, there's almost like a wall up where they have, and I hate to say it, they have low expectations from the visit. They've been told many times, your TSH looks fine. You don't need anything. Your labs look fine. Just continue the same dose. And then it's really at the end of the visit that I really start to see them open up, because we've talked about things outside of the thyroid, right? I've taken the time to listen to them and validate that their symptoms are real. We talk about other things we can focus on. And at the end of the visit, they said, wow, no one's ever taken the time to ask me about one, listen to me, and two, ask me about other things, about my lifestyle, my sleep, my diet, just all of these things together. And that's when I realized that they were coming in with low expectations. We could really break that barrier down with just having an open conversation and then move forward from there. And that's the beginning of a beautiful relationship between a physician and a patient that leads to better outcomes for the patient.
Yeah, and I wish I could say that patients never go to the endocrinologist and have their symptoms shut down, right? Like, I wish I could say that every endocrinologist, every time a patient walks into the visit, they are having their symptoms addressed. But unfortunately, that isn't the case. And I've kind of gone through this journey of waking up to that because, I was in a traditional practice for a couple of years before I started Complete Medicine. And sadly, there were partners that worked with me that were kind of treating patients as kind of a cattle call. And I think that unfortunately, this is a systematic issue, of course, and we'll talk more about that. But when a patient comes in with symptoms, and if they think it's their thyroid, but perhaps their labs are normal, saying it's not your thyroid and telling them to walk out the door, that's not the solution, right? They're still having symptoms that are legitimate that we need to address. And I think that since the time constraint is so significant in the traditional insurance-based practice space, sometimes or oftentimes when the labs are normal, the physician is like, well, this isn't in my wheelhouse anymore. Like, I'm the endocrinologist, therefore I treat the thyroid, and when the TSH is normal, well, then it's not a me problem, it's somebody else's problem. And I think that approach has led to a lot of distrust in the endocrinology field for two reasons. One, obviously that's not a way to treat a human being, right? Like, when someone comes to you with a problem and you're supposed to be helping them solve that problem, you can't just treat them like they're a lab test. That is going to make them dislike you and make them not trust you. And also, in such short amounts of time, we can't tell the patient the why or dive deep into, okay, well, maybe this lab was normal, or we maybe need to check this thing, or we need to talk about your lifestyle. You know, maybe patients are fatigued because of their thyroid, or maybe it's because they have iron deficiency anemia, or because they're not sleeping because they have a newborn at home, or they're a shift worker, or there could be 100 different reasons why a patient is feeling the way that they do feel. But if we don't give them the space and time to really uncover what that is, and we just say, this is not my thing to deal with, and push them out the door, then we don't deserve their trust at that point, you know? And so I think that narrative kind of needs to change, that the patient's symptoms aren't our problem. The patient, we're here to help a person. We're not here to treat lab numbers. So why do you guys think that a lot of patients are turning to alternative medicine or functional medicine? I know we touched upon that, but I would love to kind of hear your perspective on what's happening there.
I can take that question. So I think that alternative providers or functional medicine providers, they can spend a lot of time with our patients. So many of our patients have seen multiple providers in traditional healthcare. And because of the insurance model, like you were saying, they can only spend 10 minutes with those doctors. Oftentimes, these alternative providers or functional medicine providers are able to spend more time with the patient. And oftentimes, the first visit is about an hour. So during that visit, the patient can really tell their story. And I think many times the alternative provider or functional medicine provider can do the things that in traditional medicine we don't have time for, like really listen, show compassion, and really talk about even other lifestyle things that the patient can work on. And I think that makes a big difference because they are able to take that time to establish a relationship with the patient.
Yeah, Dr. Mehta, do you have anything to add to that?
Absolutely. And that's a big thing. Exactly what Dr. Illuri said is spending that time, establishing that trust. And then they're looking for solutions. And, you know, oftentimes they've been failed in the traditional practice. And that's where we tend to sort of run into issues, because oftentimes it's marketed. It's not all functional medicine and alternative providers are the same, but oftentimes they provide, you know, like one solution that's going to fix their problems. But it's so nuanced, and I think we're doing them a disservice by not spending that time with them as endocrinologists. And because we know the basics of thyroid physiology, how it functions, and not spending that time is we're giving our patients away, and maybe even putting them in harm's way with some of the supplements that they get that are unregulated, and medications when they don't quite understand the science behind some of the medications, which can lead to more harm than good.
Yeah, and I have actually heard an endocrinologist say, well, my years of training and experience have enabled me to make a diagnosis in 5 minutes. And that may not be true. And sometimes I look at a patient's lab and I know the diagnosis before they come in, but that doesn't mean that I only spend 2 minutes with them, because they're not just their diagnosis, right? They're a whole person who you have to understand their goals and their eccentricities, everything, the things that matter to that person in order for them to believe in you and in order to create a plan that actually makes sense for them. So I think we as physicians kind of do ourselves a disservice by accepting this insurance-based system that only gives us this small amount of time with our patients and saying that that's okay. I think that the doctors who are saying, well, I can make a diagnosis that fast, are actually harming themselves, because sure, maybe you can make a diagnosis that fast, but you're still losing the trust of the patient. And ultimately, at the end of the day, the trust of the patient is what enables you to care for them. And so, and you can't build trust with anybody in a split second, Some of us can do it faster than others, but people do need time. And the other thing they need is support and access. So like if you made a super quick diagnosis, gave a patient a prescription, and then had them follow up with your nurse practitioner or your PA like 6 months later, and they don't see you again for a year, the likelihood that that patient is going to do what you came up with is so much lower than if you actually came up with a plan that was truly for them and then were there to implement it. So what we've done in complete medicine is try to bridge that gap of, we're not prescribing alternative medicine or selling supplements or selling lab tests that aren't based in science, but we are giving the patients the time to really evaluate what they need. And I think what we've seen in our practice is that it works. Patients are no longer seeking potentially harmful supplements, for example, after we've had the chance to explain the why behind why we don't recommend that they take those. I think a lot of our colleagues, and I'll let Vidhya talk more about this, about what we kind of see about our colleagues kind of in our own groups or threads, complaining about patients with non-specific complaints and how we might need to flip that script. Vidhya, do you want to talk a little bit more about that?
Yeah. And, just for reference, I was in a traditional healthcare setting for 10 years before I joined complete medicine. So I completely get it. We get overbooked. Our time with patients becomes less and less and less. And it is really frustrating to work in that setting, because you just don't feel like you can have the time with the patient that you deserve and then they deserve. But I would hear my colleagues and honestly myself at times, look at our schedule and be like, oh gosh, this patient is here. And, you can do a quick review and be like, they don't have thyroid disease, but they're here because they think they have thyroid disease. And you can kind of feel yourself getting frustrated because you don't have the time to spend with your patient to explain. And then that creates this antagonistic relationship, like even before the patient walks in. And when that is what is happening, nobody benefits. The provider gets frustrated and the patient gets frustrated. And then that's what builds that distrust. And of course, you're going to see results of patients being critical of endocrinologists on the internet or on social media, and then looking for alternative providers or a provider that will sit and listen. So unfortunately, you see it all the time. And we can sit here as endocrinologists on our thrones and be like, well, we went and did this training. We are all board certified. We've done years of thyroid work, both in the hospital, outside of the hospital. We have seen the worst of the worst cases. But if we don't take time to explain to that our background and our reasoning to our patients individually, we will lose our patients. And we're already seeing it happen. like you said, Dr. Thangudu, like, yes, an endocrinologist can look at a case and make a diagnosis in 5 minutes. I fully believe that many endocrinologists can do that, but our patient didn't go to medical school with us. So when they have waited 3 months to sit in the office in front of the expert and they're only given a 5-minute explanation, how can they fully understand all of the expertise that's gone into making that decision? They can't in 5 minutes. So part of our job as endocrinologists is to educate our patients too with the knowledge that we have. And that takes time.
Yeah. And I think social media has changed what people view as expertise. And I think there's so many endocrinologists and physicians in general who want to write that off and say, well, all of that stuff is stupid, or, it's fluff, or like, don't listen to anybody online. But the fact of the matter is that's where our patients are looking first before they see us. And I think that we have to be where our patients are, and we have to catch up with them, and we have to understand the things that they're seeing so that we can diagnose and treat the problem that might not be something that we learned in medical school or training or fellowship. The problem might be that they're getting a lot of misinformation from somewhere, and if we have no idea what that is, then how are we gonna treat that? We can't be stuck in just what we learned in our fellowship. So, Dr. Mehta, what are your thoughts on how social media has changed the way people perceive what an expert is?
That's a great question, and it's so prevalent in this day and age that we're in. I think my patients tell me, they said, we're here, but we don't know what to believe and who to believe, because there's so many thyroid experts out there on social media, and some may be physicians and many are not physicians. And there's contradicting information. There's all sorts of information that's floating around, and the patients are trying to make sense of it. And like Vidhya said, they haven't been to medical school. They don't know how to put all of these facts together. What's the big picture? And so they tend to focus on certain things like, certain labs or certain medications. And then they come to you asking for help. And then when they get dismissed, when we say, oh, your TSH is fine, please continue your dose, or you don't need thyroid replacement, your antibodies are positive, but your levels are fine, they feel dismissed. And then this propagates this issue at hand, where they keep hearing more about it, but we're not listening or taking the time to explain things to them. And 9 times out of 10, when I sit down and just explain the physiology of the thyroid gland, the pituitary gland, and how these hormones function, they get it. They feel heard. And then also I feel like I did my job in protecting them from, being preyed on by certain providers who are trying to sell supplements or put them on super therapeutic doses of thyroid hormone that could lead them to be in the hospital, lead to bigger issues like atrial fibrillation, which is an irregular heart rhythm that can lead to secondary issues such as a stroke or bone loss and worsening osteoporosis. And so again, it comes down to just taking the time to help them tease through all of this information that's out there, and guide them towards more scientific, evidence-based medicine and practice.
Yeah, we live in this world where influence matters more than your credentials. If people see somebody's face on social media, and they are saying they're an expert, and they see them over and over again, and they're saying what they think is correct, what they believe is correct, whatever, people believe that more than our 10 different diplomas on our wall. And we live in an age with just information overload. And so if we can't expect that patients just believe us because we went to medical school and did years and years of training anymore, that time has passed. And if we can't accept that and figure out ways to overcome that, then we're going to be stuck in the past. And this doesn't really even matter for our ego, because most endocrinologists are not short of patients regardless, right? But it puts our patients in harm's way if we can't give them safe, effective information. And I'm not trying to say every alternative practitioner or every functional medicine doctor is practicing in an unsafe way. That is not what we're trying to say. We're not trying to say who's right or wrong. And maybe they can serve some of these patients better than an endocrinologist can. That's perfectly okay. If the patient makes a informed decision to see somebody else, that's okay. But what we don't want to see happening is people walking away from safe endocrinology because they simply were not given the time of day that they needed to build the trust in the system. And I think all of us would agree that we don't trust the healthcare system either. We don't trust the traditional healthcare system either. Those 5-minute visits, 3 to 6 month wait time, we don't like that. That's why we all walked away from it. So we get it so much that we walked away from it too. But that doesn't mean that it's not all or nothing, right? Like, everything in the healthcare system is not bad. There are still doctors with expertise in that. But there are things that are certainly missing from it that we hope to provide both sides of the story in our practice, but also alternative medicine, while sometimes they are able to give patients the time of day, can offer patients solutions that might not be safe. And a couple of things that alternative practitioners can do can be oversimplifying things. So I would love to hear, Dr. Illuri, will you talk about some of these oversimplifications that are really catchy on social media? Like, they are things that people can latch onto in a reel or something, but may not be telling the whole story or relevant to every single patient.
Yeah, I think one of the things I hear the most from my patients, and then maybe I've seen on social media, is, did your endocrinologist check a full thyroid panel? As if, like, we're gatekeeping thyroid labs or some secret information that we don't want our patients to have. So just whatever that means to somebody, a full thyroid panel, it just suggests that endocrinologists aren't detail oriented, or there's some secret information that we are withholding from our patients that should be evaluated. So I think that's one of the biggest ones that I see, the full thyroid panel. But I also think that's really interesting because I think one of the ways that some of these alternative practices can make money is ordering lab tests. So if they can order more labs and make more money off of them, and then also trend them, which may or may not make any sense when you actually look at the science, they can bill for those labs and collect payments at whatever frequency they want. So that's probably one of the main things I hear on social media, or I hear from my patients, like, are you going to order the full thyroid panel?
Yeah, it irks me because there's no such thing as a full thyroid panel. Like, any practitioner can you can put your own order sets in any sort of electronic medical record and then call it whatever you want. And then the patient will see that on their lab test, but there's nothing at LabCorp or Quest or something that we can type in and it's full thyroid panel. So it's kind of this confusing information. And a lot of these thyroid experts that aren't endocrinologists will say, well, I know the science doesn't show this, but seeing reverse T3 in my patients does help me based on my experience, which, sure, that might be true. Sometimes we say things like that too to our patients, like, based on my experience, I haven't seen a lot of people have that particular side effect with Ozempic or whatever it is, right? Like, we do use our experience and expertise. And I think that becomes really confusing too, because okay, well, if somebody's an expert, their experience and expertise means something to you. And if you think they're an expert and somebody else doesn't, then what they say means something to you, whereas it doesn't matter to somebody else. So I think that's where we kind of get into this clash with alternative practitioners, where the endocrinologist is like, well, they're not even an expert. Why does their like experience and expertise matter to the patient? But the patient feels that they are an expert, right? And so I think that it's just kind of an interesting thing to think about when we're thinking about why patients are moving in this direction. And I actually don't think that the labs are like the hill that we should die on anymore. In the past, I used to get really annoyed by it. But, you know, if someone is seeing thyroid patients and they're ordering these labs, yes, there's some ethical questions there of ordering tests. But if a patient is willing to pay for them and they are informed about it and they want to do that, that almost seems like a distraction from the bigger issue. If we are like, that lab isn't necessary. Maybe it is, maybe it's not. Like, the science may not show it, but if this practitioner sees a lot of thyroid patients and it helps them, I really don't think that is something that we should be focusing on. The more important thing is patient safety, right? And a blood test, it might confuse them, but the likelihood of any of these frequently used thyroid tests that aren't really supported by evidence, most often reverse T3, having someone test that, it's not going to really hurt them to get it done most of the time. I think the more important thing is talking about like the potential dangers. And if an alternative practitioner is aware of the dangers of thyroid hormone overtreatment and they're preventing their patients from being overtreated and keeping them in a safe range, and the patient is happy and doing well, great, that's great. And if they're not, then that's what scares me. I think a big issue, though, is that one is that endocrinologists and alternative practitioners are not talking to each other. They're just kind of talking bad about each other in their own silos, which I don't think is useful or constructive. And perhaps alternative practitioners, that's kind of their marketing strategy. Like, endocrinologists don't know anything, come buy my potion. That's some of them, but not necessarily all of them. Some of them I do think are truly trying to help people. But I think the other thing about it is that we are biased because the alternative practitioners are seeing patients who have failed traditional endocrinology, right? They have felt dismissed or their symptoms weren't getting better. They're seeing basically our train wrecks, right? The patients that did not do well with endocrinology. And on the flip side, endocrinologists are seeing the train wrecks that come from alternative medicine, that come from being prescribed much too high doses of T3, or who have had complications, or God forbid are in the hospital, or, you know, having really, really bad things. And maybe not unfortunately, but the reality is when a patient is sick in the hospital due to a thyroid problem, an alternative medicine doctor and a functional medicine doctor is not being called. It's us, the endocrinologist, who's being called by the ICU to help them save the patient's life. So would you guys like to talk a little bit more about that? Like, what have you actually seen happening to patients when they aren't getting proper treatment by an endocrinologist or an expert in thyroid who is more on the alternative or functional side?
Yeah, I've seen patients who were seeing more of an alternative medicine doctor or a functional medicine doctor, perhaps getting compound thyroid therapy or something like desiccated pig thyroid hormone. And labs
That's called Armor,
right,
or Nature Thyroid. Our listeners might have heard of those. That's
thyroid.
desiccated pig thyroid.
Mhm. And I will see rapid heart rate. I've seen a patient come into the hospital with psychosis brought in by her family members. And ultimately, it was figured out that it was due to excess thyroid hormone therapy. I've also seen elderly patients come into my clinic pretty underweight with severe osteoporosis. So these are really big problems and really serious side effects to overtreatment of thyroid hormone.
Yeah, and so atrial fibrillation is a pretty common cardiac arrhythmia or heart rhythm problem that can happen from hyperthyroidism very commonly. And I have seen patients have strokes from hyperthyroidism. And when people have a stroke, they can die from it or have long-term neurological deficits. They can't walk, they can't use their arms, their faces, different things can happen when you have a stroke that can't be fixed. And hyperthyroidism is a fairly common cause of it. And I have EP colleagues, so electrophysiologists, they're the cardiologists that deal with abnormal heart rhythms, and they do things like ablations and stuff like that. I've had multiple of them come to me asking, like, what is going on? I have all these patients who have AFib. They're coming to me for an ablation because their doctor is telling them that their super suppressed TSH or hyperthyroidism is normal. Like, they should have a really low TSH. That's what will make them feel good. But they have cardiac arrhythmias, and they're having these procedures that don't come without risk by the cardiologists who don't feel like they know better because their physician is telling them one thing. And like, this is a real situation. This is something that has actually happened to me in my life as a physician and an endocrinologist. Like, you might notice that at kids' birthday parties, all the doctors get together and start talking about stuff. That's how this happened to me and how I found out about this in the electrophysiology world. So there's that. Yeah, osteoporosis is real. And, it's not just bone loss, right, that we're worried about. It's what happens with that. Well, people have falls, fractures, hip fractures increases the risk of mortality, of death, and disability too. So it's not like just we don't want people to have these high thyroid doses because we don't like it. It's because we're really seeing dangerous things happen to our patients when they have it. And I have the joy of being married to an ICU physician, and I'll tell you, every single week I get a question from him about, or just a story from him about how someone was on inappropriate hormone therapy, whether it's thyroid or testosterone or something else, and they come in with a life-threatening event or they die because of it. So this is not some small thing that we are just on our high horse for the fun of being an expert. It's because we are really concerned about our patients. And supplements are not, people feel like they're more natural. And just because something is natural doesn't mean it's safe. Like, a lot of our illicit drugs are natural substances, right? And that doesn't make them safe. So a lot of supplements, like thyroid supplements, have whopping doses of iodine that can unpredictably affect the thyroid. Or some of these supplements have dry animal organs that actually have hormones in them that can really affect a human's hormones in unpredictable ways, or just make them have toxic levels of those hormones. So supplements are not more safe, even if they are more natural. And I think people really need to start thinking about that. The other thing that we hear people say is, well, if somebody has all of the symptoms of hypothyroidism, some of those symptoms being like fatigue, depressed mood, dry skin, weight gain, then it must be the thyroid. Dr. Mehta, you want to talk a little bit about that?
Yes, I worry about when they really oversimplify things and try to pinpoint everything to one etiology or one cause for all your symptoms. That's hard. Oftentimes it's multifactorial, and we know that, but communicating that to the patient is so important, right? So they feel heard. And the first thing that I tell my patients is that your symptoms are real. Now, let's talk about what we're going to do to find out what's causing it. And that's where I think we play an important role in explaining that we're going to test the thyroid, and we'll talk about which tests are relevant, why, which ones are not, but explaining this to them, taking the time to go over that with them. And then also saying, look, we may not find the answer, but that doesn't mean we're done. We need to keep digging deeper and assessing all the other things and getting a detailed history, talking about their lifestyle, their periods. For a lot of our patients are, women, middle-aged women. No one has ever spoken to them about their periods in years, oftentimes. And addressing all of these things is so important to get to the bottom of this. And this keeps them from, pursuing avenues where the provider says, oh, your thyroid labs look fine, but you're feeling poorly. Let's just start you on levothyroxine, and then they're on it for the rest of their lives. So trying to really take the time and explaining, one, validating their symptoms and how they feel, and then working with them. It's more of a collaborative approach between the patient and the physician to get them to feel better, and optimizing different areas of their life and their health, physical health, mental health is so important.
Yeah, Dr. Illuri, do you have anything to add to that?
Yeah, I think one of the difficult things about some of the thyroid hormone deficiency, hypothyroid symptoms, is they're pretty common and can occur with a lot of other conditions. So some of the symptoms are like fatigue and dry skin and feeling down or depressed or feeling cold, and those symptoms can be from a number of things. Someone can have true depression. They can have obstructive sleep apnea causing very poor sleep. Perhaps they do have a skin condition and need to see a dermatologist for evaluation. So there could be something else we're missing if we're oversimplifying it too. I actually have a concrete case of this. I had a patient who had a pituitary surgery. I mean, this is a big endocrinology case. She had a pituitary surgery, and she had multiple hormones that were affected. And the most importantly, her cortisol was low. She had adrenal insufficiency. She ended up seeing an alternative practice first because the name of the practice had hormones in the title. It's like hormones expert, something like that. So she went there, and they started her on Armour Thyroid, which we all know is very dangerous when you're presenting with adrenal insufficiency. And it just, because everybody who walks into that clinic getting fatigue and, dry skin and depressed mood just gets labeled with thyroid deficiency. And it's like, oh, you must have a thyroid problem. A very important diagnosis was missed for this patient. And thankfully, she ended up in endocrinology and was able to get steroid replacement, which is actually what that patient needed. And she's doing well now. But if you're oversimplifying things and saying everybody that has fatigue and dry skin and depressed mood has hypothyroidism, you could be missing really serious diagnoses that the patients need treatment for. And that is really scary.
Yeah, so just to kind of flesh that out. So when a patient has adrenal insufficiency, like their adrenal glands are not producing enough cortisol, giving them thyroid hormone can precipitate adrenal crisis, which will probably most certainly land them in the hospital, but if not kill them. So it is super, super important to be nuanced in your ability to diagnose, to ensure that you're not putting a patient with adrenal insufficiency on thyroid hormone. And there are typical symptoms of adrenal insufficiency that we can assess for to ensure that our patients are not presenting with adrenal insufficiency. But that's a huge miss. And I think one red flag is if a clinic is like, I am a X clinic, like I am a testosterone clinic, if they are basically saying what their treatment is in their name. I'm a Botox clinic, right? Like that should be a big red flag, because that means you're not going to get a nuanced diagnosis. You're just getting what it is they're selling, right? So I think that there are people who like know what they want and they're going after it to get it, and nothing's going to stop them. I don't think that's the best approach to your health, but yeah, I think that is one red flag. But there are people who would say like, well, if you're experiencing fatigue and depressed mood and all of these things, if it sounds like thyroid disease, if it quacks like a duck, then it must be that, even if the labs are normal. And I'm not saying that maybe we shouldn't be more detailed about our lab evaluation. Maybe some people do need that in certain scenarios. That's fine. I think doing more in-depth thyroid labs could be helpful in certain situations. But that is like, I always say this thing that I think is funny. That's like saying, oh my gosh, well, I have migraines, I must have an ibuprofen deficiency. Like, no, that's absolutely ridiculous, right? So just because you have fatigue or depressed mood or I should say, and dry skin, it doesn't necessarily mean that that's all due to a thyroid hormone deficiency. You have to have a much more nuanced diagnosis and approach to a patient presenting with symptoms, because sometimes people have those depression and fatigue because they have premenstrual dysphoric disorder. Maybe it's cyclic, or sometimes people have dry skin because they have eczema, or they're taking really hot showers, or they're not moisturizing their skin. Oftentimes people are fatigued because they're not sleeping well, or they have a sleep disorder like sleep apnea. These are really common disorders that have similar symptoms to hypothyroidism. And I think that endocrinology says these symptoms are non-specific, and that has almost become like a negative connotation of non-specific symptoms. So maybe we shouldn't use that word anymore, but like the reason is that when we anchor on a diagnosis, if we feel so sure that a diagnosis is what it is and don't evaluate potential other causes, we can miss really big things like adrenal insufficiency in Dr. Illuri's case, or depression that could be treated with medication, perimenopause that could be treated hormonally, and instead give patients a treatment that could cause them potential harm. So I think that the point is not to put down any type of medicine here. The point is that people deserve a nuanced approach to their health care by an expert in that space. And I think that has become very, very challenging in thyroid disease. And it, in part, is our fault. We have to we can't just keep saying, well, we're the experts. We have to really look deep and call out the ways our field has failed our patients, unfortunately. And I mean that with all the love in the world for my endocrinology colleagues, and not in a way of putting anybody down, but just questioning and asking us to take a giant step back and trying to see what is it that we're doing that is pushing patients to potentially unsafe places, and what can we do better to earn these patients' trust and help them find the solutions that they need in a way that we know is safe to keep them out of the hospital or keep them from getting really sick. Dr. Illuri and Dr. Mehta, do you have anything to add to that?
Well, yes, I agree with everything you said. And I think if you have questions as a patient, it is sometimes, it's sad but true, but sometimes it takes, meeting a couple of different physicians and finding a fit that's right for you. And when you do that, things will connect and you can get the care that you deserve, and you don't have to kind of be out fending for yourself. And I wish it could be more simple than that. I know it's hard to navigate the healthcare system at the way it is now, but we're here to kind of work with our patients and collaborate and explain why certain things. What I hear a lot is, I want to be on natural thyroid hormone, right? I want to be on Armour thyroid because that's natural, but that's not quite physiologic to the human body. That's just an example. But talking about how the ratios differ and how we're not opposed to doing T4 and T3 therapy, but in a more scientific, safe, physiologic way. So finding an endocrinologist who's willing to listen is important. So don't give up, and hopefully you can find the right fit for you.
Yeah, no decent physician will ever be offended or think anything of you getting a second opinion, because just like finding a spouse, the relationship matters, and like not everybody is going to be the right fit for you. I'm not the right fit for every patient either. So I think that if you aren't getting the support that you feel you need, seeking out a different doctor is just fine. I think that the other thing about T3 and T4, like Dr. Mehta mentioned, is T3 has antidepressant qualities. It is a treatment for depression in patients who are refractory to other depression medications in the absence of thyroid disease. So patients who have depression aren't responding to other antidepressants, who do not have thyroid disease. We know they don't have thyroid disease. Some of them get put on T3 to help the depression. And so a lot of people do feel better on these combination therapies and on T3 therapies for that reason, and also because now we have ATA guidelines actually do recommend adding T3. So in patients who aren't improving on T4 only preparations like levothyroxine or Synthroid, because of potential peripheral lack of conversion of T4 to T3 that we didn't know as well even when I was training. So that is more of a new concept that endocrinologists who are up to date should be comfortable with. But if you are seeing an endocrinologist, there are some old school endocrinologists, right, that maybe aren't abreast of that new information. That is something that you should advocate for, or seek somebody who's able to kind of walk you through the different options. I had a patient just yesterday who we are doing a trial of T3. Her TSH has been normal for a really long time, but she's just having some fatigue and unable to get over this hump. So we're going to do a trial. I also have had patients who have tried T3 and they don't do well on it. So it's not the solution for every single person. Some people do great on it. Some people can't stand it. And some people just simply don't need it. But I'm glad that you brought that up, because I think that is a place where a lot of alternative providers try to differentiate themselves. Like we do T3 and endocrinologists don't. That's simply untrue. Endocrinologists who are nuanced and up to date know about T3 and know how to use it safely. It's highly potent, and it can be very dangerous if used incorrectly, with all the complications that we talked about before. But if it's used safely and patients are monitored well and they have access and support by their doctor and their care team, then they can do just fine on T3. So I love this conversation. I think that it's really important for patients to see kind of this side of endocrinologists, and for us to be vulnerable too about how we're really trying to navigate this changing landscape in healthcare and hormonal healthcare, and trying to figure out what we can do to protect our patients and honor their goals and needs all at the same time. And it can feel really frustrating, I know, as an endocrinologist, especially when you're really strapped for time and your clinic isn't running efficiently and all of those things. But I think as a group, if we can step back and recognize where our patients are seeing us fail and bridge those gaps, I think we'll be a lot better for ourselves and more importantly for our patients. Direct care is a great place to marry high-level endocrinology while also giving patients the time of day. We're not going to go too deep into the healthcare system on this episode because it's a whole episode in itself. but the way endocrinology has moved for a lot of reasons, it's just a high volume, really high volume practice setting in the insurance model. So if you're a patient who needs an endocrinologist but isn't getting the time of day that you feel you need, trying a direct care endocrinology practice might be a great option for you. And that's all we have got for you today. I hope we have given you some food for thought if you're an endocrinologist or a patient, and given you some motivation to really advocate for yourself, your family members, and your patients. If you are interested in learning more about topics similar, continue to listen to our podcast. You can also find me on Instagram at Dr. Arti Thangudu, just my name, and same for YouTube. And if you are interested in being our patient, we would love to see you. You can find out more information on our website, sacomplete.com, and all of those links will be in the show notes.